Good evening, everyone. I understand we all tired, so I'll just wrap this up. I've been introduced, Veronicah Akankunda from Uganda, East Africa. I'm the CEO and founder of Golden Age Elderly Homes Uganda. Golden Age happens to be the only care home in the entire country. Reason being that back in my country, people don't believe in care homes. So it's an idea that is still fresh, but glad enough it's picking up. So my presentation is on understanding dementia and then the role of care homes when it comes to caring for people who have dementia and Alzheimer's. So because of time, I'm just going to, run through it. Per presentations, people have talked about dementia, how to treat it, the applications that are coming up to best care for people that have dementia and neurological disorders. So what we do at Golden Age is it's a residential facility where people come in and get personalized care. We mostly deal with people who have dementia. And like I said, in Africa, this is the first care home that is up and running. But through our beliefs, people believe our care homes are a no-go for Africans. We have a saying that we take care of our own. When someone is put in a care home, they believe you have abandoned them, and it's a system that people haven't started believing in. However, when you're to look through it, you find that the elderly are being neglected. They are left at the mercies of untrained maids, relatives, and then they don't get to have professional care. So when we bring the people to the care home, you get to realize that they get care that they deserve. They get to, their nutrition gets to improve, and then they have 24/7 hour care on their side. So Golden Age, what we do is have these people, put them on a personalized arrangement where they get to have the best care they can, compared to someone staying at home and being taken care of a maid or what do you guys call nannies that are not trained. They don't know what dementia is. So some of the challenges that we find is by the time they bring someone to the center, you realize that the patient has been mismanaged. They look at dementia as something that is categorized under mental issue. They have very limited information on dementia and Alzheimer's. So when someone gets to have uncoordinated stories, things are not patching up. So the best solution they run to is black magic, or mixing up concoctions, thinking someone has run mad because of some of the challenges that dementia people go through. So Golden Age has a center where we have an organized plan for each patient that we put them on. We look at recreation activities, we look at nutrition, we look at psychological care. Most of these people are neglected. So someone who has dementia, you realize that they feel abandoned, and then some of them slip into depression. And because of the kind of environment that they stay in, you find that their situation deteriorates. So tomorrow we still have another presentation. So we'll, dig deeper into this, and then we shall expound more. Thank you so much.
Okay,